Hey everyone, welcome back to the channel. Today we're diving into a topic that might not be on everyone's radar, but it's super important for those of us who are active, especially kids and teenagers involved in sports. We're talking about Sever's disease. Now, before you start thinking this sounds like something out of a horror movie, let me assure you, it's not as scary as it sounds. In fact, it's quite common, and with the right knowledge, totally manageable. So, what exactly is Sever's disease? Well, it's a condition that affects the heel of growing children, typically between the ages of 8 and 15. It's also known as calcaneal apophysitis, which is a mouthful, right? But don't let the fancy name fool you. It's basically an inflammation of the growth plate in the heel bone. This usually happens during periods of rapid growth, which can be pretty intense, especially for active kiddos. Now let's break it down a bit. Picture this. Your child is running around, playing soccer, basketball, or any sport they love. They're having a blast, but then they start complaining about heel pain. It's not just a little discomfort. It can really affect their ability to play and enjoy those activities. This is where Sever's disease comes into play. The repetitive stress from all that running and jumping can irritate the growth plate, leading to pain and discomfort. You might be wondering, is this something I need to worry about? The short answer is no, but it's definitely something to keep an eye on. The good news is that Sever's disease is not a permanent condition. It's a temporary phase that many kids go through. Most of the time, it resolves on its own as they grow and their bones mature. However, it's crucial to recognize the signs and take action to prevent it from getting worse. So, how do you know if your child might have Sever's disease? The most common symptom is heel pain, which can sometimes be accompanied by swelling or tenderness around the heel. Kids might limp or avoid putting weight on that foot, and they could be more sensitive when you touch the area. If you notice any of these signs, it's a good idea to consult with a healthcare professional to get a proper diagnosis. Now, let's talk about what you can do if you suspect your child has Sever's disease. First things first, rest is key. It might be tough to tell your little athlete to take a break, but reducing the intensity of their activities can really help. This doesn't mean they have to stop being active altogether. Low-impact activities like swimming or cycling can be great alternatives while they heal. Another important aspect is ice therapy. Applying ice to the affected area for about 15 to 20 minutes can help reduce inflammation and alleviate pain. And don't forget about stretching. Tight calf muscles can contribute to heel pain, so incorporating some gentle stretching exercises can be beneficial. Footwear is also something to consider. Make sure your child is wearing supportive shoes that fit well. Sometimes, simply switching to a pair of cushioned sneakers can make a world of difference. If your child is involved in sports, they might benefit from custom orthotics, which can provide additional support and cushioning for their feet. Now, I know what you might be thinking. What about medications? Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage the pain, but always consult with a healthcare professional before giving any medication to your child. And here's where it gets interesting. While Sever's disease is primarily a physical condition, it can also have emotional impacts. Kids who are used to being active might feel frustrated or upset when they can't participate in their favorite sports. It's essential to support them emotionally during this time. Encourage them to focus on other interests or hobbies, and remind them that this is just a temporary setback. As they heal, it's a good opportunity to educate them about their bodies and the importance of listening to their pain signals. Teach them that it's okay to take a step back when something doesn't feel right, and that their health should always come first. This mindset can help them in the long run, not just in sports, but in life. So how long does it take to recover from Sever's disease? Generally, it can take anywhere from a few weeks to several months, depending on the severity of the condition and how well your child follows the recommended treatment plan. The key is patience. Encourage your child to be patient with their healing process and remind them that their body is doing its best to recover. Lastly, let's touch on prevention. If your child has had Sever's disease once, they may be more prone to it in the future, especially during growth spurts. To help prevent it from recurring, Make sure they're maintaining a balanced routine that includes strength training, flexibility exercises, and proper warm-ups before activities. Encourage cross-training to give their feet a break from repetitive stress, and always keep an eye on their footwear. In conclusion, while Sever's disease might sound intimidating, it's a common condition that many kids experience. With the right knowledge, support, and care, it can be managed effectively. Remember to listen to your child's body, prioritize rest and recovery, and keep a positive attitude throughout the process. Thanks for tuning in today. If you found this information helpful, don't forget to like, subscribe, and share this video with anyone who might benefit from it. Until next time, take care of yourselves and each other.